Okay, so I went to my name is Bonnie. I went to my Any Meetings website. I'm going to add my PowerPoint, so I'm going to click or drop a file here. I'm looking for my file that I just did. It's oral cancer presentation 580. Okay. It's loading right here. Okay. And it's loaded. I'm going to delete. And I'm going to delete because I also need to click or add a file here. I was looking for how to add my upload a file to share, but I'm going to try something different. So I'm going to go ahead and go back into my interactive meeting of the meeting that's already going on.
Welcome to Any Meeting. Your line is now unmuted.
So what I'm going to do is I'm going to put my mode on for question and
All
answer.
attendees are muted and may unmute themselves by pressing *6.
And that means that they have to unmute themselves and then they ask their questions. Let's see. I need to create the poll, add a new poll, and one question is, what is your age? And I'm going to put 18 to 30 and 31 to 50. And I'm going to put 51 to 70 and then 70 plus. Delete a poll. Let's see, add a new poll. I'm going to put my results as totals and percentages. That way everybody knows. So I'm going to add my new question is, what is, are you a smoker? And then it is yes or no. And then I'm going to put start voting. I'm going to have to work on that. I'm not sure about that. So I'm going to go down here to the share screen, and I'm going to share the full screen. And what I'm going to do is I'm going to bring up the content. I'm going to share my PowerPoint. I'm going to open my presentation. It is not going to let me share a link with you, but I'm going to add it to my PowerPoint presentation. Okay, here's my presentation. I am going to do the welcome everybody to my presentation about oral cancer. We'll start in a couple of minutes. We're just waiting for everybody to come in. Right, oral cancer facts. Cancer of the mouth accounts for approximately 4% of cancers in men and 2% in women. Cancers of the mouth is the 6th most common form of cancer. Squamous cell carcinomas are attributed for about 90% of all oral cancers. Deaths due to oral and oropharyngeal cancer represent approximately 2% total in men and 1% total in women. Annual cases of oral cancer in the United States is approximately 35,000. Annual deaths in the U.S. from oral cancer is about 9,500. Oral cancer has a 40% 5-year survival rate despite relative increases in other cancers. Two most important risk factors for cancer of the mouth is the use of tobacco and alcohol. Smoking is the single most important risk factor for oral cancer. Tobacco and alcohol synergistically increase the risk of oral cancer. Cancer of the lip is heavy exposure to ultraviolet rays of the sun and smokeless tobacco. Causes of oral cancer. There's two types of research that is converging to unravel the events that lead to cancer. One type of research is site-specific alterations of oncogenes. The second type of research is epidemiological evidence to link exposures to exogenous agents to specific forms of cancer. And what that is the alcohol, the tobacco, and also evidence of specific viruses and cancers from hematopoietic and lymphoid tissues such as uterine cervix and carcinoma of the oropharynx. And what that is the vaccine HPV strain 16 is causing a new wave in oral cancer in those that don't smoke, don't drink, but they are having contact with the same HPV, which is human papillomavirus, that causes uterine cancer, uterine cervix cancer. Here's some images. Sometimes they're real drastic. There's the squamous cell carcinoma, and this is on like a 41-year-old woman who doesn't smoke or drink. This one is on an older person who has been a smoker all their life, and if you look how far down into the throat that's way at the base of the tongue. And also this is what, when you pull your tongue up and turn it, and these are all cancerous. Signs and symptoms. Most oral cancer in the early stages go unnoticed. Just like most cancers, they don't have a lot of symptoms. You can be what they say asymptomatic. Most often it can be painless and very little physical change. Some of the stuff that you see here, you know, what would you think if you saw that on yourself? It may appear white or a red patch of the tissue. It could be small indurated ulcer, like a canker sore. It could be a lump or a mass inside your mouth or neck, pain or difficulty in swallowing, speaking, or chewing. Wart-like masses. When it's the wart, it's more linked to the viruses. More signs and symptoms is the hoarseness over a long time, numbness in the orofacial region, persistent earache, and it is important to have a sore or discolored area of your mouth that does not heal within 14 days looked at by a professional. The treatment for oral cancer is surgery, radiation therapy, and chemotherapy. Detection. How are you detected? The best thing is regular visits to your dentist for an oral cancer screening. If you're in the dental office and when you're hygienist and you are not getting an oral cancer screening, it is very important that you make sure you ask about that. The second thing, especially for smokers who drink or drinkers who smoke, if you consume either one, you need to do a monthly or smokeless tobacco. You need to do a monthly self-check exam. Here's a link that can be followed on YouTube, and it helps show you what you need to do. Detection. And this doesn't follow, but I'm going to continue here because I need to change this. Cessation of tobacco and alcohol products. I know it said to stop smoking and drink in moderation. I placed a link about stop smoking, and that'll give you a really good link to stop smoking because it's not just oral cancer, but it affects your whole body. There is an alcohol withdrawal hotline that I placed here because it is not easy to stop doing either one of those. And these are my references. Okay, does anybody have any questions? So, and on the notes, I'm not going to be able to put that in my notes either. My link to share. I need to create a poll, so I need to go back out of my meeting and see if I can do that. I created my polls, but now I'm going back into my active meeting.
Welcome to any meeting. The line is now unmuted.
I'm going to run a poll. So I need to know, start voting and close my polling. Let's see. The only thing I'm not able to do is put my file to share, so I'm going to have to investigate in that a little bit. Thank you very much.